We will talk about the COVID-19 pandemic. The problem with the virus is how fast people can become infected. Moreover, we have seen that many folks do not want to comply with the county, state, and even government rules in how to contain the virus. Throughout the 3 years COVID has been present, there has been a significant number of deaths as well as infected people cases. This is due to all the different variants that keep showing up, most recently known as Omicron. Davis has instated many regulations in order to keep the community safe. It has provided testing centers as well as free masks. Moreover, the majority of the population in Davis includes college students and retirees, who are a population that are more prone to get the vaccination and actually take COVID precautions. Some important precautions include keeping a 6 feet distance as well as wearing the adequate mask and washing your hands and sanitizing them whenever outside. It is important to think of the people around you and stay home when feeling sick and get the vaccination in order to keep others safe as well.
The main biological principle that is being affected here is homeostasis and how COVID-19 can disrupt that. Homeostasis in this case refers to the oxygen carrying abilities of the body, ability to sense oxygen levels, and the overall health of the respiratory system. COVID-19 disrupts the body's ability to maintain homeostasis through a myriad of respiratory issues it causes to infected victims, particularly those who are already at high risk of suffering from respiratory issues, such as those who suffer from asthma, elderly and infant age people, and those with weakened immune systems. When someone contracts COVID, they may suffer from a wide variety of effects to the respiratory system. According to the CDC, this may include, but is not limited to, difficulty breathing, shortness of breath, chest and stomach pain, and even constant tiredness or fatigue. However, something that is often overlooked is the possibility of suffering these symptoms long after the immune system eradicates the virus. The possibility of prolonged symptoms can further add to the disruption of long-term homeostasis and prevents a previously infected person from returning to quote-unquote normal blood oxygen levels. In order to maintain homeostasis, we must learn how to reduce the risk of contracting the virus in the first place. The CDC recommends that getting vaccinated, along with getting scheduled boosters and wearing a face mask that covers both the nose and mouth, are the single most effective methods of avoiding the virus. Keeping a minimum of 6 feet apart from people, especially in crowded environments, also ensures that you keep a literal distance from coming into contact with respiratory droplets from an infected person. Finally, properly washing your hands with soap and water also ensures that you can avoid spreading possible droplets onto your face or eyes. These basic steps help drastically reduce the possibility of contracting COVID-19, which in turn helps the body maintain an adequate level of homeostasis.
From the international perspective, especially in Shanghai, China, our COVID-19 policy is wear masks in public places, hand sanitize before, during, after you enter the public places. Show the green QR code before you enter the public places. Let me show you the QR code. This part is the green QR code. This part will indicate that you haven't been to high-risk areas in past 2 weeks. And for the following part, it indicates that you have fully been vaccinated and test negative for the COVID-19. People are asked to show this complete page before they entering the shopping mall or other common places. Focusing on the data above, this is the total number of COVID-19 infections in China today, which is around 25,000. And here is the total number of infected people in China since the first outbreak in 2019, which is around 163,000. This number is not easy for a country with a large population like China. And the reason why the number of infected people can be controlled so well is because of the strict prevention and the high cooperation of the people. Although we've been coexisted with the COVID-19 for almost 3 years, we still have to pay high attention and keep our mask on, sanitize all the time, get fully vaccinated and boost as well, stay away from the crowds and keep social distance. Thanks for watching and please keep safe.